Hey everybody, it's Dr. Lisa Ann Homick from Homick Advanced Chiropractic, and this is my YouTube channel called Brain Snob, and my schedule just opened up, so what do? Take advantage of the time and finish the video series. This is part 2 of, what did I call it? Your poisoned nervous system is not contagious to others. But first, let me introduce why we need to be brain snobs. If you know how your brain works, you can give yourself amazing life experiences. Especially, you should be growing your talent every day. That means challenging yourself to be a little bit better today than you were yesterday at anything. This means doing something difficult to build new brain neuron patterns. New brain wiring. We need your full participation in the world, and you cannot do that with a burdened brain. You should be sharing your talents with the world also. Chiropractic, that's my favorite topic, as if you can't tell by now. Chiropractic is a brain-intensive teaching method. Adjustments of the spine, those are my access points to your brain. When we boost the brain, you can disrupt the unwanted patterns in your life that you do not like. You can instill preferred patterns. I teach you how to move your brain, feed your brain, and talk to your brain. And most importantly, prioritize the healing process. The brain chooses what to heal first, second, and then third, and so on and so forth. The brain chooses. Now I use the word heal loosely because heal, there's A and B. You're not healed and you're healed, and that I don't like that terminology. Healing means your body needs to be fixed, that it went wrong or that it went rogue, and that's not accurate. Actually, your body goes into one of two stages: the protection stage and then the rebuilding stage. That's it. Your brain chooses what stage it needs to be in at the moment based on your stresses at that time. The brain chooses. You can partner with your brain or you can drain your brain. So you pick how you want to be helpful to your own body. Everything the body does is correct for the situation. I teach you how to interpret the situation so you can be a partner, not a hindrance. So in one world, everything is a health crisis. Then there's the chiropractic world. So join me. You already have the tools. Don't leave them idle in your toolbox. I'll teach you how to make the best of what God gave you. So let's continue on. This article I started reading a few days ago in part 1. It is called Questioning COVID. It is available on the WestonAPrice.org. The Weston A. Price Foundation is where you can access this article. The other day I read the summary, so now let's fill in the blanks and get into some more detail. And if you feel like things were left unexplained because I only read the summary, now we're going to fill in those blanks. So let's see. As a physician, I practice in Italy. So the author of this article was in Italy at the beginning media frenzy, I guess I'll call it, in 2020, before things started getting locked down and all that stuff. As a physician, I practice in Italy when the rumors about the symptoms of the so-called pandemic were first published. I immediately realized I had already seen one patient in early January with the same syndrome. Then I encountered another patient who was similarly affected. Both patients were in their 80s. Both of these patients were given antibiotics for the pulmonary problems, but they did not improve. When I examined them, I did not hear the typical sounds of bronchitis. So this is important. Nor did I notice signs of pneumonia. Hang on to that thought. The x-rays of the thorax were negative for lobar pneumonia, but showed dirty lungs. There was a diffuse crackle sound similar to pulmonary edema, which would be water in the lungs, even though the patient did not act as though they were drowning in water, which is the typical reaction to this condition. Both patients had a low respiratory rate, but they were not gasping for air. When I consulted with an anesthesiologist friend, he confirmed that COVID patients have a decreased respiratory rate along with low oxygen saturation. That's not how the body should respond. So let me continue on. The combination points to a neurological problem, as the normal function of the respiratory center in the central nervous system is to raise the respiratory rate when oxygen saturation goes below threshold. The brain should be reacting in a survival type manner. It's not in these conditions. The brain is kind of asleep on the job. Both patients showed signs of intoxication from neuroleptic drugs, such as Haldol, and had soft swellings on the arms or legs. The first patient had difficulty swallowing but refused the jellied liquid that the hospitals give for this condition. His initial fever went down in 2 days, but his little cough persisted and he was unable to bring up any phlegm. White blood cell counts for both patients were slightly elevated, but still within normal range. Both patients showed a deep deterioration of mobility. They couldn't even hold a cup. The immobility led to bed sores. Other signs were miosis, contraction of the pupils, sleepiness, and slurred speech. The first patient was taking beta blockers, an anaphylactic for the prostate, and metformin for diabetes. Now, the metformin was discontinued because this patient stopped taking in food. The beta blockers were also discontinued to help the cough bring up phlegm because the heart rate was too low. So I mentioned in the previous video that medications, they manipulate the nervous system, and now they had to discontinue these medications because they were not allowing the nervous system to fight back and regain control over the situation. This patient was unable to stay awake. Food intake was extremely difficult. It took several minutes to chew one bite. However, after he was given an orange to eat, he could stay awake longer and talk again. Now, this is fascinating. They gave him an orange, which I would call a living food. It's got active enzymes that are alive compared to what you get at the hospital. It took him several weeks to recover and months to eat on his own, but he did get better. It took months, so the doctor was very patient, and sometimes we lose patience when it comes to this type of situation. Now, the second patient eventually passed away, but months after the initial symptoms and after the pandemic was announced. Naturally, these strange cases made me ask why. Why did the first patient have these symptoms even though there was no infection? There was no infection. So whatever you define infection as, so hang on to that. C-reactive protein, which is a marker for inflammation, was elevated, probably due to the thrombosis on the arm. But what was causing the problem in the lungs? The cough was triggered mainly by drinking or difficulty in breathing. So that sounds to me like a nervous system response to the situation. The nervous system is trying to correct a situation. The second patient was taking haloperidol, an anaphylactic drug, a beta blocker, and metformin. Later, the haloperidol was discontinued due to the muscle stiffness, but still, he had all the same strange symptoms as the first patient. So now we're going to dive into a little bit deeper. Inhibitory drugs. Even though these patients suffer the same exact symptoms of the new virus described everywhere, no one who took care of them got sick, even without the masks and without the gloves. Why? I'm going to repeat this. Nobody around the folks got sick. Of course, I kept asking why. Why was I seeing such strange symptoms? The beginning of an answer came when I received an article originally written for Spanish physicians that listed the drugs that significantly increased the mortality rate of these patients. All the drugs outlined in the document inhibit the fight-or-flight sympathetic nervous system, including neuroleptics such as haloperidol, anticholinergic drugs, and benzodiazepines, opioids, barbiturates, proton pump inhibitors, ACE inhibitors, and other medications to lower blood pressure. These people were at a disadvantage. Their nervous systems were dampened. They could not get back into the rebuilding stage of the body, what the body needed to bounce back. In retirement homes and hospitals, most are given antipsychotic drugs to keep them calm. However, the COVID-19 patient needs a reactivation of the sympathetic nervous system. So sit back and take that in. People are already at a disadvantage. They can't win this fight because they have no fight left in them, because their nervous system, the fight was sucked out of them. To me, that's crucial. As a chiropractor, I understand how the sympathetic nervous system has to intermingle with the needs of the parasympathetic nervous system. So the fight or flight should be short-lived, it should be brief, but you should have enough strength in the body to fight back and recover. They don't have the ability to recover because the medications have taken that away from them. I can't stop stressing this. This is crucial. Let's see. The common blood pressure drugs also work to counteract the effects of the sympathetic nervous system. Now, stop here for a second. If you're going to climb 3 flights of stairs, you need your blood pressure to go up. And when you're at the top of those 3 flights of stairs, your blood pressure should then go back down in a reasonable amount of time. You shouldn't be out of breath and suffering for very long. That's one, if you're in shape, and number 2, your body isn't being manipulated by a drug that keeps your blood pressure lower, so you cannot access the appropriate blood pressure for your activity level. I hope that makes sense to you. Okay, although insulin was not on the list, we know that diabetics are more susceptible to suffering and dying from COVID-19, as insulin, in fact, is known to cause pharmacological stress affecting the nervous system. And I know we don't use natural insulin, it's synthetic. So let's cover the autonomic nervous system briefly here. The somatic nervous system responds to the conscious will to voluntarily move skeletal muscle. In contrast, the autonomic nervous system controls those functions that we are not consciously aware of. In very general terms, the autonomic nervous system has 2 components: the sympathetic, fight or flight, and the parasympathetic. we call that rest and digest. So we want a nice balance between the two as you go through your day, as you go through your life. Acetylcholine is a natural neurotransmitter for our entire nervous system, both central and peripheral, including the autonomic nervous system. Thus, when acetylcholinesterase, the enzyme responsible for clearing the acetylcholine, is not working properly, the whole body is affected. To overcome fatal consequences, the body has to make more receptors to reactivate the nervous system. Without going too deep in this, I'm just trying to explain the body wants to compensate. Wherever it's lacking something, it's going to make more of something. That's how the body responds. We have many examples of drugs and toxins that interfere with the action of cholinesterase, the enzymes. We call them neurotoxins, causing excessive salivation and eye watering in low doses, followed by muscle spasms and ultimately death in higher doses. Snake venom and nerve gas are examples of two potent cholinesterase inhibitors, leading to paralysis and death. Many insecticides, such as organophosphates, also act as cholinesterase inhibitors. So these are inhibiting essential enzymes that keep you alive. The adrenal medulla, the inner part of that adrenal gland, produces neurotransmitters for the sympathetic nervous system. Adrenaline and noradrenaline, also known as norepinephrine. Okay, I can't edit. Sorry, I don't spend the time. Sorry about my pronunciations here. While the adrenal cortex, the outer part of the adrenal gland, produces corticoid hormones for the parasympathetic nervous system. When the adrenal medulla is not working, as in COVID-19, this will affect the adrenal cortex as well. These patients may be given steroids, but these treat the cortical adrenal insufficiency, not the medulla where the problem is. I'm almost done here. We're going to have part 3 in the next few days. As mentioned earlier, the center for respiratory control is in the medulla oblongata. It is part of the autonomic nervous system and thus dependent on the neurotransmitter acetylcholine and accompanying clearance by acetylcholinesterase. Let me repeat the prior paragraph. When these patients are given steroids, that addresses the cortical adrenal insufficiency. It does not address the medulla. I just said in the next sentence, the respiratory control is in the medulla. So are we robbing Peter to pay Paul, or just paying too much attention at one area and ignoring the other area? Let's dive into this a little bit more. At the beginning, I thought that perhaps some virus was affecting the nervous system, but why was the disease not contagious? The first patient was also cared for in a hospital where nobody got sick. I myself did not get sick, and no one among the caregivers at his retirement home got sick, nor did the second patient pass the illness to family members. Nobody involved in his care got sick. Masks and gloves were not used in those early days. One public health official in Milan had the task of following family members of COVID-19 patients during the pandemic in March and April 2020 and found no one got infected. Bars and restaurants on the highways remained open even during the stricter lockdowns of this peak, but nobody has gotten infected despite customers taking off their masks to eat and drink. I know some young people who did get sick. What they had in common was they were all cannabis smokers, but no one else in their families got sick. So I guess he delved a little more deeply in the history of these other patients. Cannabis is one of the drugs listed in the Spanish document, and we know that cannabis works by blocking the sympathetic nervous system. A worker in a nearby food store got sick. He was also a cannabis smoker. But though he had contact with lots of people, no one he came in contact with got the virus. Why? So I'm going to stop there. This article is on the website at the Weston A. Price Foundation. You can read the entire article. It is about 30 pages long. I will continue reading the rest of this article in a future video. I just like the part explaining how we really shouldn't be messing up the sympathetic nervous system. We shouldn't be messing up the parasympathetic nervous system either. We should be respecting the nervous system because the brain knows what it needs to do. We got to get out of the way. And sometimes the brain, well, every time, hold on there, the brain chooses what needs rebuilding first. It may not always be what you want it to be. And that's why I have to talk to my folks and say, look, be patient. Your body needs to fix something else first before it fixes what you are most preoccupied with. So when folks come to me with back pain, neck pain, headaches, and they're hanging around, it's because something else needs healing. And we need to address that something else first. And that first is the brain, because brain first, body follows. So it's not easy. Nobody ever said this was going to be easy. I'm going to focus on the next video, maybe in the next few days. And I hope you are going to stick around and continue researching this information, because I find it fascinating. You have got the tools. You've just got to learn how to use them proficiently. So hang out with me. Home-Make Advanced Chiropractic and Brain Sense Telehealth self-discovery sessions. You can watch other videos, subscribe, hit the like button. What else? I've got a blog. And then you've got my ear. You can call me up and let's talk about what you're dealing with in life and see how, actually I'm going to point out how well your brain is taking care of you and how you can be a partner with your brain. Thanks for watching.